Assalamualaikum warahmatullahi wabarakatuh. Dengar ke?
Dengar, Doktor.
Okey lah. Semua ada dah kan?
InsyaAllah.
Okey, kita dengan umul kitab Al-Fatihah. Alhamdulillah, wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi Okay, so without further ado, kita akan start kelas. Cuma, sepatutnya kelas apa hari ni? Sepatutnya apa? BST sepatutnya. Hello?
Ya, Doktor. Patutnya
Okay.
BST.
Okay, so since tak boleh buat BST, then kita buat ni lah, kita buat simulation, clocking simulation. Sebab I don't really prefer apa, case presentation, because I know these are not the case yang you guys encounter kan, case other people punya case. So I don't find it very useful. So choose two people. Okay, you guys will club me. Okay, I'll pretend to be the mother or the parents. You guys club me. And at the end you should come up with your diagnosis, differential diagnosis, and your management plan. Okay. Okay tak?
Okay, dah boleh.
Okay, okay sekejap ni. Actually, you guys semua kena on you punya video lah. I pun kena on, tapi saya malas lah sikit. So, you guys kena on you punya video lah untuk attendance. Unless kalau you macam tak tahu right ke, then tak apa lah. Okay, anyway, so pick one person untuk ni. Untuk club. Siapa nak club first case? Anyone? Sekejap ni. BST tak ada markah kan? Okay, good. One Ashraf Razin.
Yes, Doktor.
Okay, so you nak club kan? Tapi you dah present itu kan? Sekali.
Saya present pasal endocrine.
Page macam tu kan? Ha.
Ya.
Siapa yang tak pernah present ke? You guys semua dah ada topik untuk present? For your presentation yang untuk 10 markah tu?
Yes, Doktor.
Dan if that's the case, then tak apalah. Siapa lah? Anyone yang nak volunteer? It's okay, even kalau I laugh pun you tak tahu. I tak pasang video. Selalu I main laugh. Anyone?
Okay, saya try, Doktor.
Okay, so Ashraf Mazin. So you're going to club me. Okay, and to come up with diagnosis. Okay, so okay, this term is okay, this is you are clocking Encik Ali, father of Aminah, a 9-year-old girl who presented with acute onset of rapid breathing. Okay. So please club the father to come up with your diagnosis and discuss the management plan. Okay, faham kan? Dengar kan soalan? Dengar soalan?
Dengar, Doktor, dengar.
Ashraf dengar tak, Ashraf? Yang akan tanya soalan ni. Dengar kan? Okay. So I give you like 2 minutes to think. Okay. Because you guys third year kan, then 2 minutes to think. 1 minute lah, 1 minute to think. 2 minutes lah, I nak ambil air sebentar tu. So I give you 2 minutes to think what you want to ask and format your questions, your clerking. Then clerk me for 10 minutes. Okay, just focus on the presenting complaint, history of presenting complaint, and some other important questions that might help you to come up with your differential diagnosis and diagnosis. 50 minutes 50 minutes clerking. And then we've got another 10-minute discussion. Okay. So 1.5 minute 1.5 minute from now. Sekejap game back sekejap.
Apa tadi situation kita? Ustaz.
Ulang cap.
Rapid breathing.
9 years old.
Berapa tahun?
9
9.
tahun kan? 9 tahun. Rapid breathing. Waktu kita nak tanya ayah dia kan? Encik Adi.
Yes.
Okay, so sekarang ni yang dia kita tahu dia 9 tahun dengan rapid breathing lah. Selain tu apa lagi? Dia female.
Cute. Lepas tu kita kena tanya onset dia lah kan? Bila start.
Acute. Okay, so sekarang ni chief complaint dia 9 tahun rapid breathing acute. Okay, so apa kita nak tanya?
Intro.
Go through Socrates dulu first.
Okay, ready
Dalam
Okay. Socrates tu untuk pain. So this one, remember the question is okay, macam you are a medical, you are a houseman in PH General Ward. Okay, you were asked to clerk Encik Ali, father of Aminah, a 9-year-old girl who presented with acute episodes of rapid breathing. Okay, so please clerk the father to come out with your differential diagnosis and discuss the management plan. Okay, jom. So Ashraf.
Okay. Jadi doktor berlakon jadi Encik Ali ke?
Yes.
Oh.
You are a houseman Okay. Okay lah, start dah tanya. Sekejap, I set masa sekejap. 50 minutes 50 minutes is a lot of time So, okay, start.
Okay, Assalamualaikum Encik Adi.
Yes.
Okay, saya Dr. Ashraf. Okay, jadi macam mana nak start? Okay, so soalan saya lah. Okay, anak encik nama apa tadi?
Oh, nama saya Ali.
Nama anak encik tadi?
Oh, anak saya Aminah.
Aminah, okay. So, tanya pasal history of presenting illness. Okay, semasa rapid breathing ni, yang ni first time ke berlaku?
Ya.
Oh, first time. Sebelum ni tak pernah berlaku lah.
Encik ni siapa?
Oh, minta maaf. Okay, nama saya Ashraf. HO dekat hospital Sultanah Nur Zahirah. Jadi sekarang ni insyaAllah lah nak clear encik, nak tanya tentang keadaan anak encik.
Okay.
Okay, jadi apa soalan nak tanya? Okay,
You pernah clerk a patient lah? Tak pernah clerk?
tak pernah keluar.
Tak pernah clerk patient?
Tak.
Okay, tak pernah. Okay, so try lah.
So anak encik Aminah ni maksudnya kali pertama lah berlaku simptom macam ni.
Oh, itulah. Anak saya tak pernah lagi nafas macam lelah macam ni.
Ya. Oh. Okey lagi bila dia berlaku?
Start pagi ni, yang dia malam tadi lah dia dah cakap, dia dah mengadu dah, dia macam kata susah nafas. Saya pun letak lah Vic sikit. Lepas tu pagi ni macam tak boleh pergi sekolah lah, tu saya buat kat sini ni.
Oh. Okey, jadi macam tu maksudnya encik datang ni disebabkan oleh anak encik datang ni sebab apa, rapid breathing tadi. Maksudnya bernafas laju. Oh, okay. Dah berapa lama maksudnya keadaan anak encik?
Baru malam tadi.
Baru malam tadi. Dan encik datang ke hospital pada waktu petang ni.
Taklah ni pagi lagi ni, baru pukul 9.
9.
Pukul 9 pagi.
9 pagi. Okay. So dalam keluarga encik ada ke yang keadaan sama dengan anak encik ni?
Ada lah. Saya waktu kecil-kecil dulu saya ada lelah. Tak tahu ni lelah ke tak, tapi waktu saya kecil-kecil dulu ada lelah lah. Anak saya tak tahu dia lelah ke tak.
Oh.
Tapi adik-beradik dia, ada dah adik dia pun macam pernah lah kena masuk ward. Ambil gas macam tu, tapi wah, tak tahu lah.
Okey, selain itu anak encik ada batuk-batuk tak?
Ada?
Ada batuk
Oh, pagi ni memang tadi lah boleh start batuk-batuk. Tapi tak adalah teruk sangat batuk dia. Cuma dia batuk lah sikit-sikit.
Oh. Anak encik pun ada cakap yang dia rasa pahit. Ada rasa sakit dada tak?
Dia ada susah nafas.
Nak nafas. Oh, okey. Oh, selain itu
Baring, tak boleh tidur kan tadi.
Oh, tak boleh tidur lah. Sampai ganggu lah. Selain itu dalam keluarga encik ada siapa-siapa yang ada alergi ke?
Tak ada allergic.
Ada alergi ya? Oh.
Saya lah ada sikit rasa, macam kalau makan makan seafood tu adalah kata-kata sikit.
Oh, okey. Selain tu encik ada bela kucing ke dekat rumah?
Tak ada.
Oh. Masa tu anak encik batuk-batuk tu, dia batuk macam mana? Ada keluar cair ke ataupun hanya batuk kering ke?
Tak ada juga. Batuk adalah kahak, memang ada kahak lah sikit. Tapi dia telan je dia tu.
Oh.
Macam saya marah tu. Kau telan macam mana nak hilang batuk?
Okey. Masa anak encik tu start apa tu? Dia yang bernafas laju tu, dia buat apa time tu?
Dia tengah tidur.
Tengah tidur. Berapa lama tu dia bernafas laju tu?
Saya cakap lah daripada malam tadi.
Okey, daripada mana?
Tapi pasal lagi Vic tu dia okey sikit. So pagi ni macam makin teruk pula.
Lagi. Anak encik ada demam tak?
Tak ada demam.
Tak Dia demam.
Dia sihat je, memang dia sihat je lah. Tiba-tiba mak tadi tiba-tiba je. Nak kata dia salah makan, tak ada salah makan.
Selain yang bernafas laju tu, okey ada batuk kan, ada batuk, ada kahak sikit. Lepas tu tapi tak ada demam. Ada selain tu ada apa-apa lagi, muntah ke?
Tak ada.
Tak ada.
Dia ada batuk, so sesama tak ada lah. Macam pagi ni ada rasa sesama sikit, tapi dia memang biasa. Setiap pagi pun dia memang sesama dia ni. Dia kecil ke. Batuk lah, batuk. Dia muntah sekali. Saat batuk pun saat batuk lah. Batuk banyak sangat dia muntah.
Apa lagi ya? Okey, ni minta maaf Encik, tapi ni ada soalan sensitif sikit. Dalam keluarga Encik ada yang merokok ke?
Saya memang merokok. Tapi saya tak merokok dari rumah. Biasa lah. Lorry driver macam saya ni memang rokok lah kita orang.
Oh. Masa anak Encik apa tu, yang bernafas laju tu dia ada bunyi tak?
Ada tak bunyi? Bunyi macam orang lelah tu.
Bunyi macam lelah.
Saya ingat lah waktu saya kecil tu kalau saya lelah bunyi macam tu tak? Macam whistle tu.
Oh, okey. Dia lelah, dia masa bunyi tu masa masa hembus nafas ke masa tarik nafas?
Awak tak perasan aku tak benda tu.
Perasan.
Tapi kalau nak nafas pun susah, tak tahulah. Lepas tu hembus ke atau tarik nafas.
Jadi saya rasa tu juga Encik Ali nak tanya.
Okey lah doktor. Okey lah. Saya pun ada nak pergi makanan sekejap ni. Okey. Okey tu je soalan nak tanya. Ayuh korang ni. Korang tak pernah club patient ke?
Tak pernah doktor, sorry.
First year, second year pun tak pernah club patient?
Tak pernah.
Wah, sistem tak berapa lah sistem korang ni. Sistem UIA. Bukan UIA je, Malaysia punya medical system je tak bagus lah. Medical education. Anyway, so tak apalah. Definitely you guys need some exposure lah from beginning. Bukan nak tunggu take year, tapi lah, that's the system kan. So what do you understand about presenting complaint? Okay, what is the performa or the criteria for clerking? The rubrics or the performa for clerking. Apa yang the component of clerking, medical clerking? You are the first presenting complaint kan? Then you ada apa?
HOPI.
Okay, history of presenting illness. Okay lagi?
Past medical history.
Past medical history. Okay lagi?
Drug history.
Systemic review.
Systemic review. Okay. Systemic review should be before past medical history lah. Okay. Okay lagi?
Family history.
Family history, social history, drug history. The arrangement depending on what is your suspicion. Because you should actually can get some ideas what is the problem. Okay, a good doctor, in fact any doctor, should have some idea on what is the problem at the first 3 to 5 minutes of clerking. Okay, at first 3 to 5 minutes you should have some idea. So that will help you to arrange your questions. Okay, depending on the presenting complaint and HOPI, you will decide what to ask and how to ask and which one to ask first. So you ada drug history, family history, medical history, you've got social history, and then you've got bagilah and so on lah, allergic history semua, drug history kan. Okay, so what do you understand about presenting complaint?
What brings the patient to the hospital?
Okay, so that's a question first yang you kena tanya kan. What makes you here? What brings you here? Okay, why are you here? So that is the type of questions. Okay. To first, satu presenting complaint. So you expect when you ask presenting complaint, the answer should be like one sentence. So presenting complaint should ideally be one complaint or at most two. Tapi usually it should be one. The immediate reason. Okay, contoh kan, patient might be swollen lah. Contoh kita ada patient nephrotic syndrome yang dah 4 minggu kat rumah. Dia dah swollen macam balloon lah. Dia datang macam balloon kan. Tapi bila you tanya, presenting complaint not necessarily because of swelling. Sometimes because, oh dia demam lah hari ni. Tapi dia bengkak seminggu. Tapi tak boleh, dia datang sebab demam. Ataupun, dia may datang, patient may have complaint, very weird complaint ataupun not related to disease. Contoh kan, dia datang, sebab anak saya ni, cikgu komplain dia selalu tidur dalam kelas. Contoh. Sedangkan patient tu actually dia ada problem dengan bedwetting ataupun dia ada problem snoring yang very bad snoring. Tapi dia datang sebab cikgu komplain anak dia tidur dalam kelas. So it has to usually is one single sentence atau two sentence lah. So in this case, what is the presenting complaint? Rapid breathing kan. Okay, so what is HOPI?
From the first time that the parent notice that the child is unwell until the time that you get to see the patient. Can.
Okay, good. So anything I heard, that's a very good answer. So anything that happened from the onset of illness until the time of attendance to hospital, the time of arrival. So anything that occur within that period is what we call HOPI. Okay, so HOPI ni senang je. You nak tanya, you ask about what, how, when, why. This is the method. Okay, kalau if the presenting complaint is pain, then the Socrates is the HOPI. You understand kan? Pain then Socrates is the HOPI. If there are for other complaints, you just use the WH question lah. Why, what, how, where, when. Okay, who. Sometimes who can actually be a history of presenting complaint. Okay, and for example, like this question, right? Okay, this case, okay, presenting complaint is rapid breathing. You remember rapid breathing? Okay, so what is presenting complaint? Rapid breathing. Okay, when? So when is the onset? Okay, how the complaint progress? Is it worsening? Is it improving? Is it intermittent? Okay, how? And then what else? WH. What, when, how, and then how it started. Okay, and then the other what you can ask about what is associated complaint, what is associated symptoms. For example, rapid breathing kan, it's a respiratory problems kan. Rapid breathing, then you may have respiratory or cardiac problem. So you have to ask anything related to cardiac and respiratory. So respiratory you ada upper tract and lower tract kan. So now the presentation is, the presenting complaint is rapid breathing, which is the LRTI kan, lower respiratory tract infection, lower tract pathology. Then you have to ask wheezing kan, noisy breathing. So noisy breathing, be specific lah, wheezing. Okay, have you heard any like whistling sound? Oh, sorry lah, you guys guna bahasa Melayu. So ada dengar bunyi macam whistle ataupun bunyi dengkur. Ask about that. Lepas tu nampak tak dada dia macam susah nafas sampai lekuk-lekuk. Ataupun nampak okay, lepas tu dia tanya apa respiratory tract punya symptoms lah. Cough, runny nose. Then dia kata ada cough. Then you have to detailing on the cough. So bila cough, so each complaint tu you kena go detail, you kena ask the parents to describe the problems. Contoh cough kan, cough. So apa yang nak kena tanya pasal cough? The nature of the cough, the duration of the cough, what triggers the cough, what make it worse, what make it better. Okay, faham tak? Any complaint, you have to ask about all this. Okay, what make it better, what make it worse, what triggers. Okay, faham kan? And then apa lagi? You ask about alleviating factors. Okay, so ayah dia kata, memang tak boleh, cannot lie down kan, cannot sleep. Then what make it better? Oh, sitting up make it better. Okay, don't know, is it heart failure ke apa ni? Kan? Ataupun but lung pathology pun is better by sitting up because that's when you can use your accessory muscle. Kalau you baring, you cannot use your sternocleidomastoid. Faham tak? You cannot use most of your accessory muscle kalau you baring. Okay, you need to sit up. Like in medical kan, you ada patient COPD, what is the typical posture? Dia akan sit forward kan? Sit forward, dia akan lean forward, sit up, lean forward, and they use the sternocleidomastoid to breathe. To increase the lung capacity. Okay, lepas tu, so these are the questions you kena tanya lah. And each of the answer has to be clarified further, explore. Okay, faham kan? So that is HOPI. After HOPI is systematic review lah. Okay, systematic review, you can just screen all the system. So at least you have to ask one question pertaining to each system lah. Contoh macam neuro kan, yang tanya, nampak lethargic ke? Nampak lethargic, is there any abnormal behavior, any seizure? Okay, just ask yes or no. This is just closed question. Okay, ideally your presenting complaint should be the most open-ended questions. And then your presenting complaint start with open-ended questions, followed with a closed-ended question. Closed question, faham tak? Contoh kan, is there any other symptoms associated with your rapid? Is there any other symptoms comes with your rapid breathing? With the rapid breathing? Oh yes, or ada cough. Okay, contoh dia kata, got okay, cough lah. So can you describe the cough? This is still an open-ended kan? And then you go narrow and closer and closer. So can you describe the cough? Oh, it's a wet cough. Okay, and then is there any barking cough? Any whooping cough? Any whooping? Does the cough comes in bouts? Ataupun does it continuous cough lasted for like few hours or few minutes? Or is it just a irritating cough? You have to describe and start with open and then follow with narrow questions to guide the parents. Okay, to get information that you wanted lah. Okay, tu HOPI kan. And then systematic review, you just ask about all of the system. Okay. Lepas tu apa lagi? After that, you tanya past medical history kan. Okay, past medical history, has your child been admitted before? Okay, if yes, why? Okay, has your doctor told you that she's got any like medical problem? Any follow up? Does she has any follow up? Okay, apa so? Has she been prescribed with like long term medication? Benda macam tu lah, compliance and then you tanya pasal family history. Family history be specific because as I mentioned, within 3 to 5 minutes you should have an idea what is the problem, or at least your working diagnosis. So definitely you have to ask family history, past medical history, birth history, neonatal history, immunization history. But tackle this, you have to cater, you have to adjust all these questions based on your differential. Because the aim is to rule in a diagnosis or to rule out another diagnosis. Okay, faham kan? Okay, so contoh back to this questions kan. So rapid breathing, what do you want to ask in your HOPI? Okay, Alisa, what do you want to ask? Patient presented with rapid breathing.
When did it start?
Okay, so it started since last night. Okay, and then this morning worsened this morning. Okay, Umifa, what do you want to ask?
Anything that trigger the rapid breathing?
Not sure. Maybe.
Okay.
Not sure.
Anything that can make it better?
She looks better by sitting up. Okay. Okay, Syazwani pula.
Did the rapid breathing worsen at night or day?
Yes, it started at night and then it worsened over the night. Okay. Give one Amni.
Um, does the rapid breathing accompanied by vigorous chest movement?
Yes. The chest is moving up and down rapidly. Okay. Okay, Alisa dah kan. Nabila, Safril.
Does the rapid breathing present with any sound like
Yes.
whistling?
Dia cakap memang ada macam bunyi lelah tu, macam whistling sound. Okay, Fatih Nani.
Does the rapid breathing occurs continuously or it occurs only for certain times?
It's continuous. She become rapid breathing since night until now. Not improve.
And then does the face has any colors, any bluish or pale discoloration?
She does look a bit pale, but there's no like bluish. Doesn't become bluish. Okay, Fatih Nani, cepat. Fatih Nani, soalan.
Does the acute rapid breathing associated with any movement?
Movement what? Movement of?
Movement, body movement.
Means dancing.
I will if she's sitting or lying down.
Oh, okay. Posture lah, posture. You mean posture?
Oh, posture.
Okay, yeah, it's better by sitting up. Lagi you tanya lah associated. Tak payahlah tanya rapid breathing tu macam dah banyak dah kot. So you tanya pasal benda lain lah. Pasal cough ke, runny nose. Then by this time, macam kita tahu, rapid breathing usually is either cardio atau respi kan. Then you can ask any palpitation because it's 9-year-old kan. Dia macam any palpitation ke, any sweating ke, macam tu lah, just ask. Tapi these are not that relevant in pediatric. Okay. Okay, so you've got the idea kan? So that's what you want to ask lah. Okay, now for presenting for past medical history, what type of past medical history? What sort of question you want to ask in the past medical history?
Pernah masuk hospital tak?
Okay, good. So tak pernah, ni first time masuk hospital. Lagi?
Ada alergi dengan ubat tak?
Good, very good questions. Okay, tak ada. Anak saya tak pernah makan apa-apa ubat. Ada ubat demam sikit-sikit dia makan. Najah? Najah, Zulfa.
Macam sebelum ni pernah ada buat prosedur apa-apa ke? Tak kisahlah masa kan tak pernah admitted. Prosedur apa-apa yang pernah dilakukan dekat anak?
Tak pernah pula. Dia ambil vaksin je lah dekat klinik.
Doktor, kalau saya nak tanya pasal HPI tadi, kalau exercise, means like kalau selama ni dia aktif, ada tak dia macam nampak penat ke, sangat-sangat penat ke macam tu?
Bila?
Kalau masa dia jenis yang masa main dengan kawan ke, macam tu lah.
Very good questions, good. So it shows that you're thinking kan. So part of your HPI, because your questions should be guided by what you are thinking kan, will be guided by what you're thinking. So if I mention, you should have some differential. So what is your differential now? 9-year-old datang dengan rapid breathing, acute rapid breathing. What is your main differential?
Asma
lah kan. Kalau patient 9-year-old datang dengan rapid breathing require nebulization, definitely this is asthma lah. Unless kalau patient tu ada tercekik, which is quite silly lah 9-year-old with tercekik. Biasa tercekik ni macam baby kecil-kecil kan. So your main diagnosis now is asthma. So that question is very good. Okay. So you have to ask question that will help you to diagnose asthma. And diagnosing asthma is not only doctors, because diagnose asthma orang kampung pun boleh. So, mak ayah pun boleh diagnose asthma. But what important is want to know whether the asthma is good control or is it persistent or intermittent asthma. So these are the questions you have to ask. Okay, any exercise induced? Ada tak dia jadi macam ni bila dia exercise? Atau bila exercise ada dia jadi batuk-batuk ke atau nampak dia penat, nafas laju? Oh ada doktor. Dia mah kadang dia komplain juga kalau hari ada PJ tu, mesti dia tak nak pergi sekolah. Saya kata bila PJ je dia rasa macam penat, tak larat, macam rasa susah nafas. Okay, apa lagi? What are the questions yang you kena tanya kalau you think this is asthma?
Pernah guna inhaler tak sebelum ni?
Good questions. Tak pernah. Pernah sekali lah dulu dia kena jadi macam ni kejap. Dia kena kesihatan, dia bagi dia sedut gas, lepas tu habis lah sekali je.
Okay.
You kena ask about interval symptoms. This is what we call interval symptoms lah. So what interval symptoms yang you kena tanya? Exercise induced. Okay lagi? Apa yang interval symptoms? Nocturnal symptoms kan? Macam mana nak tanya nocturnal symptoms? Siapa tadi? Rasa Wan Amni kot pegang PITS protocol kan?
Ada terjaga waktu malam sebab batuk-batuk tak asma. Sebab batuk-batuk.
So, tapi you kena be specific lah. Sebab, cuba you tengok PITS protocol kan? Sampai ada PITS protocol sekarang. Okay, how you classify whether this is persistent, mild persistent, moderate persistent, severe persistent ke, or persistent lah. Dia tak sebut pasal control, dia sebut pasal persistence. Kan dia quantify within berapa? 2 weeks kan? 2 weeks atau 4 weeks kan? Kan? Ataupun weekly. So you tanya dia, okay? In the past 1 week, okay, ada tak dia tidur, lepas tu malam dia terjaga sebab batuk. Atau malam dia terjaga sebab lelah. So dia kata, oh tak ada minggu lepas. In the past 2 weeks ada tak? Oh tak ada juga. So in the past 1 month ada? Oh in the past, dalam sebulan lepas ada sekali. Then once per month kan? So you have to ask that type of questions. Faham tak? Untuk you determine the diagnosis. So kalau contoh, because kalau dia weekly, macam once per week dia dah ada nocturnal symptoms, dia difference once every 2 weeks ataupun once every month. Faham tak? The frequency will determine whether the severity or the persistence of the asthma kan, of asthma. So apa lagi? Nocturnal symptoms lagi? Exacerbation kan? Exacerbation dia tak boleh lah, this is the first episode, so tak boleh lah tanya exacerbation. Tapi ayah dia cakap tadi kan, ada sekali dulu waktu kecil. So that's years ago kan. So tak boleh lah. Lagi apa lagi tanya? Interval symptoms. What else? Eczema, that's a good question. Valid question. Tapi you tak tanya eczema in history of presenting complaint, betul tak? In history of PI. Kan? Dia tanya eczema waktu pas medical history. Dia tanya eczema. Tapi it's a good question. Saya kata, ada ke waktu kecil-kecil dia ada kulit kering-kering, gatal-gatal. Kalau letak krim. Sekarang ni pun ada juga sikit-sikit. Dari kita letak krim okey lah. Okay, lagi apa interval symptoms? What are the interval symptoms?
Daytime symptom?
Daytime symptoms. So how do you ask daytime symptoms?
Occasional cough.
Berapa kali?
Cuba tanya. Cuba nak tanya. Cik Ashraf nak tanya tadi kan? Cuba. Macam mana nak tanya daytime symptoms?
Anak encik ada batuk-batuk ke ataupun nafas laju time waktu pagi. Ataupun berapa kali minggu lepas pada 1 minggu tu.
Ada juga sampai pagi nampak ada macam tak aktif sikit lah kadang-kadang. Lepas tu bertanya dia kata macam susah sikit nafas. Kita orang biasa kita orang so dia lihat lepas tu okey lah. Ataupun bagi Vicks ke dia okey lah.
Maksudnya dia dalam 1 minggu tu berapa kali? Ke setiap
Minggu lepas tak ada. Boleh lah. 2 minggu lepas ada sekali. So you boleh agak lah 2 weeks. Once every 2 weeks kan? One episode every 2 weeks. Okay, lagi. Apa lagi interval symptoms? Nocturnal symptoms, daytime symptoms, exercise induced, and then you ada exacerbation kan? Okay, lepas tu you tanya ada trigger. Tanya trigger lain. What are the triggers? You kena tahu lah what are the triggers. So asthma, what is the common triggers untuk asthma?
Smoke.
Smoke
Maksudnya
kan?
Habuk. The weather.
Smoke apa?
Asap, tak kisahlah asap rokok ke ataupun asap yang bakar sampah ke macam tu lah.
Okay, then you tanyalah. Okay, ada tak bila kena habuk, bila kena asap, dia nampak macam laju lelah sikit? Oh, ada doktor. Kalau air raya tu, memanglah dia main kejap je bunga api kat luar. That's typical lah. I ada asma and I memang tak boleh kena bunga api. Especially bunga api yang warna merah yang you guys bakar keluar asap banyak lah. Oh, tu memang ubat lah tu. Okay, so apa lagi? So you tanya lagi, apa? Kalau dia main kucing, dia jadi tak? Kan? Pasal apa lagi? Cold. Kalau minum air sejuk. Kalau gelap banyak sangat. Okay, laugh kan induce asthma. Laugh. Ada cry tak? Laugh memang dia induce asthma. Sebab bila you laugh, kan, you ada tendency untuk aspirate. Actually, dia aspirate yang induce asthma. I tak tahu you guys ada asthma ke tak? Tapi I kalau aspirate kan, contoh I choke ke aspirate, dia memang akan jadi laugh. Memang akan asthma. Because dia hypersensitive. You have to imagine, asthma is hypersensitivity of your airway. So when anything enter your airway, dia become hypersensitive. So dia induce you punya atopy. Faham tak? That's why bila you inhale asap, minum air sejuk kan, bila you tersedak and it will cause you asthma. Sama bila laugh you tersedak, then you akan dapat asthma. Okay, so apa lagi? So that's kind of question kan. And then you kena tanya, you may need to ask some macam past medical history earlier rather than wait until the end of HOPI or wait until the end of family history. So you boleh tanya terus, ada eczema ke tak? Ada allergic rhinitis kan? These are all associated with asthma kan? So macam I dah offer you the answer tadi. Oh, setiap pagi dia bersin. Then you have to take that cues offered by the father and explore. So what do you mean setiap pagi dia bersin? Oh, memang dia bersin lah, hidung berair-air. Bila bangun tidur je hidung berair-air. Tapi bila pergi sekolah, nak tu okey lah. So, and then you kena quantify lah. You have to understand, patient may not come with only one problem. Okay, acute situation memang dia datang dengan one problem. Tapi patient may have other condition that actually contribute to the severity of the illness. Contoh allergic rhinitis kan. Kalau you tak treat allergic rhinitis in asthma, you won't get good control. So allergic rhinitis you kena tahu lah. You need to have some knowledge lah. Allergic rhinitis you kena determine juga the severity. Is it mild persistent, moderate persistent, intermittent? Then you tanya, dah masa seminggu berapa hari yang dia jadi bersin-bersin pagi-pagi? Oh, dalam seminggu setiap hari dia jadi. Then you tahu this is a persistent kan. Then you tanya lah. Lepas tu dia hilang sendiri ke atau dia affected life? Memang tak boleh buat kerja, bersin-bersin tak boleh buat kerja. Oh, dia bersin kejap je dalam sejam, lepas tu dia hilang lah. Then you tahu this is a mild persistent. Then management will be different. Then this is severe persistent will be different. Then you kena baca lah untuk allergic rhinitis. Okay, faham tak? Okay, pasal apa lagi you kena tanya? Then kalau pas medical history you tanya exacerbation kan. Lepas tu you tanya pasal okay, tu je lah mainly. Pasal eczema, allergic rhinitis. Okay, lepas tu lagi family history.
Adik-beradik ataupun parents ada benda masalah yang sama tak sebelum ni? Maksudnya ada lelah ke tak? Ada asma?
Okay, good. Ada asma atau ada allergic rhinitis dalam family. Oh, asma, ada eczema. Atopy lah, you want to know the atopy kan dalam family. Okay, lagi? Okay, tu past medical history lah. Social history, is it important?
Parents kerja apa?
Okay, parents kerja apa? Good. Kenapa parents kerja apa important?
To know social income semua.
Okay, betul. Okay, good. Okay, lagi?
Kalau kita tanya location rumah tu maksudnya takut ada kawasan pembinaan kan?
Good, very good. Okay, so tanya ada construction ke dekat situ? Tak pernah patient ni okay kan, tiba-tiba ada asma, then possible ada construction. And this could be occupational asthma, faham tak? Tapi occupational asthma ni is usually adult lah, pediatric dia jarang ada occupational asthma. Tapi adult you have to ask about occupational asthma, asbestosis, benda macam tu lah. Tapi this more to adult lah. Okay. Lepas tu, what else? Kau social. Smoking tadi kan, pada smoking. Okay, ada cat kat rumah, ada carpet kat rumah. Kan rumah guna carpet. And then you may need to ask about rumah flat ke? Oh, rumah flat berapa tingkat? 4 tingkat. Ada tangga, ada lift, tak ada lift. Then how an asthmatic child nak naik, kan? So tu satu. And then what else? Social history, that's the main social history.
Father smoker.
Ya, pada smoker kan, pada smoker. Okay, lepas apa lagi? Social history, past medical history. Okay, okay, kalau patient ni is a well-established asthma kan, known asthma, memang dah multiple episode asthma. So, kita tanya, pernah intubated, pernah ICU admission, because patient might be intermittent, tapi kalau dia ada ICU admission ataupun ada history of intubation, then this is what we call brittle asthma. So, brittle asthma, you have to be careful. And in fact, 30% of patient who presented with severe and life-threatening asthma are actually has underlying mild persistent or intermittent asthma. Faham tak? You may have intermittent asthma, tapi some intermittent asthma they can presented intermittently, tapi with very severe asthma and even die. Okay, so don't underestimate intermittent asthma lah, they can become very bad. Okay, lagi satu kan, kalau you guys baca the latest GINA guideline 2020, I think 2020 baru je ada GINA guideline baru. August ke September lah, August kan. So according to GINA guideline, now they identifying anxiety and depression as part of contributor factor in asthma. And you know anxiety and depression is real lah, it's happened. Okay, and pediatric pun ada anxiety and depression. So you have to ask about social problems such as any stressor in the house, family dynamics, ada bully. Okay, this can actually you don't know, patient might actually have anxiety rather than it's actually asthma. Okay, because it's very difficult to differentiate anxiety and asthma. Okay, so that's kind of questions how you can ask. So at the end, lepas tu you need to ask the systematic review, systemic review so that you won't miss any other differential diagnosis. Okay, kalau patient datang dengan 9-year-old, datang rapid breathing, then you have to ask other things lah, macam intoxication ke, atau kalau dia termakan apa-apa, dia DKA maybe, so ask about abdomen. It's actually not wheezing, it's actually acidotic breathing kan. That's why you kena tanya systemic review. So ask about ada AGE ke tak, ada abdomen, lost weight, any other symptoms. So usually kan, after you ask all these questions kan, then at the end, towards the end, you can ask 3 questions yang I've been taught in my medical school lah, that I will always suggest you guys to ask. These 3 questions will help you to widen up your possible differential. Okay, what are the questions? It's ICE. Okay, in my medical school, we always ask ICE. You pernah dengar ICE? Nah, apa dia ICE?
Yang ideal concern expectation tu lah.
Yes, ideal concern expectation. You can ask this earlier, kalau macam contoh you dah blur sangat kan, you tanya je lah ni and then you get the answer. Tapi kalau better, you tanya bila towards the end lah. Okay, just to explore more. So, do you have any idea what is this? Okay, because sometimes patient came with various possible pathologies, but usually parents nowadays, especially parents nowadays, they read. they may have some idea what is the problem. Okay. So do you have any idea? Cik rasa apa yang buat anak cik jadi macam ni? Oh, saya rasa ni lah. Oh, saya rasa dia ada asma lah macam saya waktu saya kecil-kecil. Then you've got the answer lah. And then you explore further. What makes you think so? Kenapa cik rasa dia ada asma? Sebab saya dulu waktu kecil-kecil macam ni juga. Pagi-pagi resdung. Lepas tu tak boleh kena abuk. Malam batuk. Saya rasa anak saya ada benda ni. So, contoh you tak tanya pasal nocturnal symptoms tadi. Ini ayah dia kata, oh malam batuk. Then you tahu, oh ada nocturnal symptoms. So you boleh explore on that. Faham? Okay, lepas tu, ideas kan, concern. What is your main concern? Apa yang cik risau sangat anak cik ni? Lepas tu tiba dia kata, oh, contohlah patient datang dengan fever kan. You've got a child datang dengan fever in pelo. Datang fever and pelo. Atau fever with leg pain kan. Datang dengan fever and leg pain. Okay. Lepas tu you tanya dia, you pun tanya isteri, oh you fikir dalam otak you, oh this is fever with reactive arthritis. Kan? Atau viral infection with reactive arthritis. Atau viral infection with apa benda lah, septic arthritis ke in your mind kan. But you don't think about leukemia. Leukemia akan datang dengan bone pain kan. Leukemia akan datang dengan fever with bone pain. So you tanya-tanya pasal, okay, what concern you the most? Atau apa yang cik risau sangat? Apa yang merisaukan cik sekarang ni? So dia kata, oh saya risau lah. Sebab adik saya dulu ada macam ni juga. Tiba-tiba tahu leukemia. Then it triggers you, faham? It will triggers you. It will happen. Definitely it will happen. InsyaAllah in future. Kalau you do enough clocking or you have enough exposure to patient kan, this will happen. Okay. And sometimes the concern might be very ridiculous. Okay. I've met, ni example ni I bagi kat semua orang lah. Tapi this is real example lah. I've met family whose child who got 2 children diagnosed with leukemia. Okay, both died. Okay, one after another lah. Satu dia dapat leukemia, lepas tu meninggal. And then after a year, mother pregnant again. And when the second child like 3 years old, dapat leukemia and die again. So twice. You know, the first thing yang I jumpa diorang kan, I tanya, what you concerned about? What concerning you? So, cuba teka apa yang dia concern sangat. Apa yang ayah dia concern? Yang ni waktu anak first lah. Waktu anak first tu, I tanya, this is my family lah actually. So, I tanya ayah tu kan, apa yang what you concerned about kan? Lepas tu, cuba teka apa yang dia jawab. Waktu anak dia baru-baru kena leukemia. Baru nak chemo lah. Anyone can guess? The clue is ridiculous lah. Tapi that's can be parents' concern. Apa dia?
Punya buatan orang.
Okay, good. That's very ridiculous. That's too ridiculous. And definitely yang tu yang most common lah dekat kita community ni. Lagi?
Kalau saya ada anak satu lagi, akan ada sama juga ke simptom?
Oh, that's not ridiculous. That's a very good question actually. That's definitely not ridiculous lah. Okay. Of course kalau you, it's a good concern lah kan. Tapi ayah dia tanya me, what the father asked me, dia kata, dia boleh dapat anak tak nanti? Faham tak? Anak dia baru diagnosed leukemia, and dia tanya, nanti bila besar dia boleh dapat anak tak? Kan anak dia nak undergo chemoterapi kan? Dia bukan fikir pasal life or death. Life or death. Dia tanya pasal, nanti anak dia besar boleh dapat anak tak? Dia takut anak dia mandul because of chemo. But that's parents' concern. Because some parents, they are very concerned about progeny. Some parents very concerned about financial. Because sometimes parents kata, berapa kos ni? The main concern is berapa kos rawatan ni. But the main concern is, anak saya boleh jalan ke tak? Contoh anak dia ada osteosarcoma, dia boleh jalan ke tak? Kena potong kaki ke tak? Because as long as you did not tackle the concern, you won't go anywhere. Okay, some parents, they are very concerned about some things. It fixed, they are taught fixed to that. You tanya macam mana kan, dia akan pusing ke situ sekejap, pusing situ sekejap. Kan, bila you tanya any questions, dia akan pusing balik kat situ. Dia akan come back to that concern, until you explore the concern and you tackle the concern. Faham tak? So bila cakap contoh dia, I'm concerned about my child. Can he ever walk? Contoh dia datang dengan osteosarcoma kan. will he get amputated? So dia cakap, oh, I understand your concern. It's very true. It's something that's possible, definitely. But we will do our best. And that's why I'm here. Actually, I'm here. We want to investigate first what is the causes. Okay, and we will definitely do our best. And we will talk later, and I'll get my specialist to discuss with you about the possibility of amputation. Contoh. But before that, can I ask you a few more questions? Macam tu lah. Faham tak? You have to be empathic, and in the same time you have to be smart lah. Okay, but definitely need to be empathic. Okay, pasal apa lagi? ICE kan, expectation. That is very important expectation. What do you expect? Apa yang cik harapkan daripada datang ke hospital ni? Contohlah, kalau budak tu dah 4 months atau 4 weeks swollen kan, anasalka kat rumah, tiba-tiba datang hari ni. Then definitely you kena tanya, what is dia punya expectation? Okay. Kalau dia kata, oh I expect doktor bagi ubat, oh saya harap doktor boleh bagi ubat supaya anak saya boleh pergi sekolah. So sebab dia punya concern, anak dia tak pergi sekolah 4 minggu bukan sebab anak dia become anasalka. So dia cakap, okay, definitely we have to be realistic. And dia cakap, oh I understand this is your hope, but we have to be realistic. Okay. We think we may have to keep your child a bit longer in the hospital because we need to investigate and come out to find the diagnosis, and the treatment may take some time. Faham tak? So you can explore and you can show empathy and you can give solution. Tapi definitely bukan bagi false reassurance. Okay. Contoh kalau ayah dia kata, oh anak saya leukemia tak? Never say, oh taklah encik, ni bukan leukemia. Never say that. Unless kalau you memang certain dah tahu jawapan, dah tahu diagnosis, then tak apalah. So cakap, oh I understand your concern, but I need more information. We need more information. Okay, faham kan? Okay. Okay, dah tu je lah kot. Ada soalan? Since kita start lambat, so kita habis cepat lah. Start dah maghrib. Unless kalau you nak sambung, then pukul 8 kita sambung balik lah. Because actually I've got 2 cases. I cakap dah Amni kan. I've got 2 cases. Kalau lagi satu, kalau you nak, and then kita sambung balik lepas maghrib, maybe 7:30 macam tu. But before that, any questions? Faham? So it's up to you. So you guys nak buat another case after maghrib ataupun stop sampai sini?
Doktor free je ke?
Saya memang on call hari ni, so memang duduk hospital sampai esok.
I mean, if you don't mind, then that would be great.
Okay lah, so we can have another one more case after maghrib, maybe 7:30. Okay?
Okay, insyaAllah.
Okay, doktor.
Okay, so if you got any questions, you can ask me later lah, after we come back. Okay?
Okay. Thank you, doktor.
Okay.
Thank you, doctor.
Okay, Assalamualaikum.
Okay, doctor.
So Najihan awak nak ni
Ya, saya.
Okay, okay. So, this is so you are a houseman in a PITS ward of HTAA. Okay. You were asked by your MO to clerk a new case. Okay. To clerk father of Zainab, a 9-month-old girl who presented with fitting. So senang je. Okay. So clerk this patient, clerk the father to come up with your diagnosis and discuss this management plan.
Fitting edema ke apa?
Fitting. Seizure.
Okay.
Okay.
Doktor akan jadi ayah ke macam mana?
Father, yes.
Okey, baiklah. Assalamualaikum Tuan. Saya Dr. Najihah, houseman.
Sorry, sekejap. You orang Kelantan
Tak.
Oh kan, okay. Tak apa. Okay. Sorry lah, aku this idea kan orang Kelantan. Saya duduk Kelantan 4 tahun lah doing my master. So orang Kelantan dia guna tuan tau. Dia rather than guna encik, dia guna tuan. Because I never use tuan to anyone. Because I never treat anyone like my tuan lah. Tapi orang Kelantan dia memang guna tuan to others. I tak tahu, is it common dekat negeri lain ke? Tak tahu. Tapi orang Kelantan lah kan. Maybe orang Kelantan macam respectful lah, dia respect others. Okay, continue.
Okay, saya Najihah, Dr. Najihah daripada pediatrik. Boleh saya tahu apa komplain apa yang menyebabkan tuan datang sini?
Macam ni, anak saya Zainab ni semalam dia sawan. Itu yang saya datang. Memang saya risau sangat semalam.
Sawan tu boleh saya tahu tak berapa lama benda tu berlaku? Maksudnya dia kena sawan tu ada tengok tak berapa minit?
Oh, saya rasa ada 5 minit ada kot semalam.
5 minit. Dia ada demam ke?
Dia ada demam juga.
Berapa lama?
Mula tak ada pun rasa demam, dia okey je. Petang tu nampak dia macam nampak penat sikit. Nampak dia tak aktif lah sikit. Tapi tak ingat saya ada ngantuk. Tiba-tiba dia sawan. Lepas sawan tu memang panas lah rasa badan dia.
Semalam tu berapa kali berlaku sawan tu? Maksudnya sekali je ke ataupun selang berapa jam lepas tu ada lagi?
Sekali je. Lepas tu saya datang sini terus lah. Sawan saya datang sini terus. Tapi dalam kereta tu nampak macam dah berhenti lah. Bila saya sampai tu doktor kata dah tak ada dah sawan. Takut lah saya.
Sebelum ni pernah berlaku ke sawan juga?
Tak pernah, ni first time. Saya tak pernah ada sawan. Takut lah saya.
Boleh tuan macam cerita tak apa yang berlaku masa sawan tu? Maksudnya dia punya pergerakan, dia punya...
Okay. Mula petang tu saya bawa balik kerja, isteri saya suap dia makan. Dia tak nak makan sangat lah. Saya nampak macam ngantuk tu. Kita ingat dia ngantuk. Lepas tu tiba-tiba isteri saya letak dia kat tempat tidur dia tu. Dia dengar bunyi. Kita dengar macam bunyi. Macam tu. Kita mau pergi. Lepas tu nampak mata dia dah ke atas dah. Tangan dia keras. Tangan kaki dia keras. Lepas tu biru. Saya tak tahu nak buat apa. Saya bawa sini terus.
Saya faham. Sebelum ada adik-beradik sana lah awal ni saya tanya tu. Ada adik-beradik sebelum ni yang pernah kena benda yang sama tak? Maksudnya kakak dia ke waktu kecil, waktu umur macam dia?
Ni anak saya seorang je. Saya tak ada adik lain.
Okey. Selain daripada
memang sawan ke doktor? Memang sawan ke tu?
Saya rasa saya kena tanya lagi berkaitan dengan apa yang berlaku dengan anak cik supaya saya boleh bagi tahu diagnosisnya nanti.
Okay.
Apa tadi? Kejap. Mas kan tadi Encik terangkan pasal tangan dia kejung macam tu kan. Boleh tahu tak tangan tu dia duduk macam menghala ke badan ataupun dia keluar keluar, maksudnya macam
dia tengah menyarap lah waktu tu. Dia tengah menyarap baby. So dia tengah menyarap tu. Nampak macam nak terangkat lah dada dia. Macam tangan dia keras. ketar-ketar macam tu.
Lagi? Dia ada masa kecil dulu ada tak macam doktor bagi tahu ada penyakit apa-apa ke masa dia lahir dulu?
Tak. Dia lahir okey je. Lahir lepas tu balik rumah terus. Tak ada kena tahu pun. Ada kuning tapi tu pun tak adalah tinggi pun.
Siapa yang tanya ni? Kalau macam tu, setakat ni dia keep up tak dengan dia punya vaccination, immunization dia?
Okey. Semua cocok dah. Bulan 9 baru je yang 9 bulan tu. Baru je cocok dalam 2-3 hari lepas rasa. Tapi orang kata demam. Dia tak ada pula demam. Lepas cocok tu.
Faham. Encik macam boleh ada terfikir tak apa yang boleh menyebabkan berlakunya sawan ni?
Saya tak tahulah tapi sepupu saya lah seorang kan, anak dia ada sawan, orang kata sawan babi tu. Memang makan ubat lah sampai sekarang ni. Doktor tak boleh bawa kereta, tak boleh bawa motor. Dia dah besar lah tapi doktor tak kasi dia bawa kereta, bawa motor semua.
Selain daripada tu dia ada apa-apa simptom lain tak? Macam selain daripada batuk ke dia ada?
Tak ada, dia tak ada batuk, tak ada sesama pun. Dia sihat je sampai petang tadi je. Isteri saya kata dia macam tak nampak
tiba-tiba
tak aktif. Tak berapa aktif pasal tiba-tiba je.
Ada nampak dia biru, macam bibir dia biru ke tiba-tiba?
Dia sebenarnya bukanlah biru, saya ingat balik. Dia macam dia pucat.
Pucat.
Dia pucat.
Sakit tengkuk tu nak tanya. Lepas daripada sawan tu dia menangis, maksudnya dia rasa tak selesa, kita nampak dia tak selesa ke?
Tak, lepas tu dia nampak dia tidur je. Lepas kat dalam kereta dah tak ada ketar-ketar tu, tapi dekat hospital tu dia tidur je. Jadi doktor kata dah tak ada sawan. Sampai sekarang pun tak ada sawan dah.
Sebelum ni pernah masuk hospital untuk apa-apa tak? Macam kena admit ke?
Tak ada.
Prosedur apa-apa pun tak ada lah?
Tak ada.
Dia
pening sikit waktu baby, tapi okey je lah, tak ada apa pun.
Sebelum ni pernah tak bagi macam tahu apa dia ada alergi apa-apa ke? Tak ada untuk ubat ke?
Tak ada pak.
Setakat yang tahu tak ada
Dan pernah bagi Panadol je kat dia buat demam. Dia ni 9 bulan ni. Dia tak boleh cakap.
Baby ada muntah tak anak-anak cik ni?
Tak ada.
Semalam, kemarin, seminggu lepas pun tak ada
Tak ada.
Ada cik bagi ubat, maksudnya kan untuk melegakan. Tadi cik kata ada demam ke tak ada anak? Demam sikit.
Dia umum dia memang tak ada demam. Kat rumah memang tak ada demam. Tapi bila pergi hospital tu, doktor check, doktor kata demam. Saya pun merasa lah panas. Lepas dia sawan tu memang lah rasa panas. Memang rasa panas badan dia.
Cik bagi ubat Panadol ke? Maksudnya ubat demam ke untuk kurangkan tu?
Tak ada. Tak, memang dia tak panas lah. Lepas sawan tu baru perasan macam panas. Tapi saya balik kerja tu, saya sayang, saya cium dia semua, memang tak ada rasa panas lah.
Tak semua nak tanya apa dah. Sebelum-sebelum ni ada tak berlaku macam jatuh katil ke, terlanggar, terantuk apa-apa ke anak tu?
Macam mana?
Sebelum ni ada tak macam
jatuh katil? Tak ada, okey je.
Okey je terantuk yang perasan terantuk apa-apa ke tak ada
Tak ada.
Dia bernafas okey ke masa kena sawan tu?
Nampak tak perasan lah. Saya tak perasan pula nafas macam mana. Tapi okey je lah. Dia tak ada laju ke. Sedak ke, tak ada.
Uh, um, okay, baik. Doktor saya rasa takut.
Tu je. Anyone ada questions? Sat. What you can do is later bila you ada masa kan. Okay, bukan bila you ada masa, you kena cari masa lah. Okay, write down a common complaint. This is applied not only pediatric lah, semua lah. Okay, contoh pediatric kan, common complaint macam fever. Fever tu is not complaint lah, it's usually associated with symptoms. Rashes kan, seizure, tachypneic, rapid breathing, apa lagi? Swelling kan, facial puffiness, apa lagi yang common pediatric, joint pain, prolonged fever. So each of these common ni kan, common complaint ni, try to work out what to ask, what to ask, and then later lepas ni kita belajar pasal A, B, C, D, E, F, tahu kan? Yang etiologist. Tapi ni settlekan ni dulu, okay? Anyone ada questions? But what is your differential? What's your working diagnosis now?
Febrile fit.
Febrile convulsion.
Febrile fit kan? So in order, febrile seizure is a diagnosis of exclusion, kan? So you have to rule out other things, other possible diagnosis. So what are the possible diagnosis?
Meningitis.
Meningitis lagi?
Encephalitis.
Encephalitis, okay.
Childhood epilepsy.
Epilepsy, okay, good lagi.
Hypoglycemia.
Kan? Metabolic, hypoglycemia, electrolyte imbalance. Kan? These are the apa dia? Intoxication. Intoxication. Apa lagi? Itulah mainly that are the differential lah. And then you boleh syndromic, benda so that is under epilepsy. So you have to ask all of these questions. Okay, so hypoglycemia. What are risk factor for hypoglycemia? 9-month-old tiba-tiba hypoglycemia. Is it common? Not kan? So what are the risk factor untuk hypoglycemia? Poor oral intake, betul tak? Biasa poor oral intake lah. So you kena tanyalah, ada AGE symptoms ke? Ada diarrhea, ada vomiting. Memang dia memang tak sihat ke? Kan? Pasal apa lagi? Meningitis kan? Meningitis, what sort of questions you kena tanya meningitis?
Stiff neck.
Neck stiffness tak ada, jarang lah neonates atau pediatric yang young children ada neck stiffness.
Jadi tak boleh cakap ni.
Neck stiffness biasa macam, since dia tak boleh cakap, so macam mana kita nak tanya about neck stiffness? You have to ask. What sort of question you tanya?
Like dia merengek ke kalau move the tengkuk?
Okay kan, dia nampak macam extend leher lah. Dia bukan merengek. Susah sikit cakap move tengkuk. Kalau flexing the neck, ialah kalau flexing baby, dia jarang flex sendiri. Unless kalau you flex kan tekuk je lah. Tapi usually you can ask question macam irritability kan, inconsolable cry, nampak irritable ke, inconsolable cry. Lepas tu nampak kalau in terms of neck stiffness you boleh tanya, nampak dia macam selalu macam bengkokkan badan ke, arcing of the back kan, macam nampak dia macam dia duduk dia macam bengkokkan belakang, things like that lah. Tapi biasa kita tak tanya. Neck stiffness is more to a sign rather than symptoms, so kita examine patient for neck stiffness. Okay, what else? Tu meningitis kan, rashes you kena tanya lah. Takut this is meningococcal septicemia kan, meningococcal. So kena tanya about rashes. Okay, ada rashes tak? And then it's very good you tanya pasal fall tadi kan, fall, ada termakan, intoxication, ada termakan something ke, Dia tanya, oh baru merangkak ke, ada kutip something, makan ubat mak dia ada antipsychotic ke. Okay, lagi? What else? Apa lagi?
Malnutrition, doktor.
Malnutrition, okay, what type of malnutrition akan cause seizure? Acute malnutrition mungkin lah, chronic malnutrition doesn't cause seizure lah. And basically when you say about acute, saya cakap acute something yang either itulah poor intake because of diarrhea, vomiting ke macam tu lah. Tapi malnutrition per se dia tak buat seizure, jarang lah. Okay, bagi. What else? Tadi you tanya what are the differential? You cakap epilepsy kan? Then definitely you kena tanya pasal family history of epilepsy. And then what else? Developmental kan? Developmental is very, 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 very important. Okay, you cannot. The principle is because febrile seizure is a seizure with fever in a normal developing child. Okay, you tak boleh kata patient memang ada global developmental delay kan? Patient ada global developmental delay, atau patient this is a syndromic child, atau patient memang ada neonatal, ada stormy neonatal period, ada baby pram, ada IVH, ataupun ada hydrocephalus, ataupun dia ada hydrocephalus, ataupun dia ada any brain pathology. Memang you tahu patient ada septo-optic dysplasia ke, ataupun dia ada anencephaly tu memang mati dah lah. Tapi kalau macam dia ada lissencephaly ke, holoprosencephaly, and then datang dengan seizure, you kata this is a febrile seizure. No. Febrile seizure the principle is it has to be a normal child. Normal, typically developing child. So you kena tanya development dia, then tanya family history, then only you boleh kata this is a febrile seizure. Kalau family history, very strong family of seizure kan, febrile epilepsy, all siblings ada epilepsy, ataupun siblings ataupun family ada strong family of epilepsy, then you should not label this as febrile seizure. Okay, you can, okay, tapi it'll be slightly unlikely lah to be febrile seizure, and the investigation will be more lah. Okay, faham? So you boleh tanya pasal birthmark. It's quite important to ask about birthmark. Anak cik ada birthmark tak? Ada tompok-tompok tak kat badan? As well you know, this is actually neurofibromatosis kan, yang ada send ke apa, ada brain tumor ke, you don't know. Okay, you have to ask. Okay, pasal apa lagi? So metabolic tadi kan, muntah-muntah lah. Biasa kalau metabolic macam diarrhea, vomiting, electrolyte ataupun hypoglycemia, you kena tanya pasal diarrhea, vomiting lah. Okay, lepas tu what else? And then bila seizure, you have to ask about the pre-ictal, ictal and post-ictal. Okay, a good history, and from good history you can actually identify where is the focus of seizure. In patient with epilepsy kan, if you got a very good history, or ataupun just by viewing the video, you can actually tell patient ni epilepsy dia kat mana, which part of the brain, because it will affect the morphology of the seizure, especially focal seizure lah. Okay, so you can tanya dalam patient kan, pre-ictal. Okay, sebelum the seizure apa dia buat? Okay, dia tidur and dia active well. Okay, lepas tu ictal ni, waktu ictal apa dia buat? During the ictal, what happened? So you have to ask the morphology, the duration. Kalau dia, for example, dia kata, oh, up-rolling eyeball. Okay, up-rolling eyeball. And then got tonic-clonic ke? Is it tonic ke? Atau is it clonic ke? Ataupun is it tonic-clonic? Tonic means just hypertonia. Tapi clonic is clonus lah, movement of upper limb dengan lower limb kan? Because it's important for you to decide whether this is epilepsy ke or this is just febrile seizure. Okay, what else? Dia tanya, kalau dia kata, oh mata dia pandang tepi. Okay, is it left lateralization? Right lateralization? The duration is very important. Lepas tu ada macam ni, siapa cakap ni, ada mulut berbuih kan? Frothing, ada saliva kan. Drooling saliva, ada cyanosis. Okay, lepas tu apa lagi? Ada incontinence, kan, terberak. Okay, what else? So you have to describe fully tau, in detail seizure. And then post-ictal. Okay, post-ictal macam mana? After seizure tu berapa minit? Oh, 5 minutes. And then after that, okay, what the parents did during the seizure? Dia mandikan the baby ke, ataupun dia masuk ubat punggung ke, ataupun does the baby, did the baby felt warm kan, macam feverish. Lepas tu post-ictal you kena tanya, is ada post-ictal drowsiness lah, nampak drowsy ke, nampak lethargic ke, ataupun habis tu dia okay, dia main, then definitely this is not seizure lah. Okay, possible macam contoh kalau parents datang query seizure, okay, dia kata macam, oh nampak tangan dia gerak-gerak, lepas tu macam dia senyap macam tak bernafas, jadi biru kan, nangis pun jadi biru, macam tak bernafas. Saya rasa dia sawan ni, dah sawan. Tapi post-ictal, habis tu dia okay, dia boleh aktif macam biasa, tak ada post-ictal drowsiness, then this is not seizure. Okay, seizure of this kind should followed by post-ictal punya drowsiness lah, atau lethargic. Okay, faham? Okay, lepas tu apa ya? Post-ictal lain apa you kena tanya, macam you mention tadi lah, ada another episode of seizure ke tak, and between the episodes tu dia conscious ke tak. Maybe the seizure, the movement is actually like 1 minute, tapi never regain conscious, and then got another seizure after 1 hour for another 1 minute. So actually the total duration of seizure is might actually be one hour lah. So this is actually a complex seizure rather than simple seizure lah kan. And then post-ictal ada thought paralysis ke tak, ada macam paucity of movement over one side. Oh, nampak macam lepas seizure tu, tangan kanan kiri dia memang tak bergerak lah betul. Nampak macam dia tak gerak pun tangan kanan kiri. And then dia ada post-ictal drowsiness. Atau nampak macam dia tak boleh nak telan. Benda things like that lah you kena tanya. Okay. And then kalau developmental history, definitely you kena tanya detail developmental history untuk febrile seizure. Okay. And then family history, kita tanya family history for epilepsy. So social history is important in febrile seizure. What are the differential? Yang lain satu, yang quite important differential you kena tanya. Yeah, you can get the answer from social history.
Urinary tract infection.
Tak adalah common UTI ni. UTI cause ni. Tapi, okay, what sort of social history you can tanya kalau nak roll out UTI? Boleh lah. Actually, kalau patient UTI, you suspect UTI, you boleh tanya lah macam mana dia clean dia punya diapers kan, dia clean dia punya, dia basuh, dia wipes dia ke, atau dia wipes daripada behind forward ke, ataupun dia sapu ke depan rather than sapu ke belakang. Tapi usually that UTI ni that betul, Alisa Hafizah, child abuse kan, and AI. Betul, you kena tanya, definitely. Patient tangan seizure, you kena tanya pasal child abuse. Faham tak? Especially bila you examine, ada kesan lebam ke. Because this is 9 months old. You don't expect 9 months old to fall lah. They do fall, tapi bukannya high impact. Sebab 9 months old dia tak memanjat kan. And dia tak berjalan, dia just crawl. Kalau dia ni pun, dia standing, fall from standing is a low impact. Tapi people fitting, definitely you kena tanya pasal ni. So tanya, oh mak dia ada psychiatric illness. Oh tanya, oh dalam family, mak dia okey ke, sihat? Ada siapa sakit kat rumah? Oh ada, isteri saya ada psychiatric illness. Isteri saya ada schizo. So tanya dia macam mana, makan ubat tak comply. Oh rupanya mak dia tak ubat merata-rata, anak dia makan. So that's cause illness, seizure. So actually fitting because of intoxication. Atau fitting because, oh mak dia campak dia. Atau ayah dia memang dera dia. So definitely you kena tanya all this. This social history is very, 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 very important. Patient datang dengan seizure. Shaken baby syndrome. Okay. Okay, lepas apa lagi? Vaccination history, is it important? Immunization? Especially immunization umur berapa bulan. Yang important.
bulan 1.
Bulan 1 tu bagi apa bulan 1?
Lagi Hep B kan.
Hep B lagi?
Kalau bulan 2 yang bagi DTAP, lagi OPV dan HIV.
No. Okay, what is the common cause of ni? What is the common etiology of ni lah, of meningitis? Or at least used to be. Huh?
HIV.
HIV kan, Haemophilus influenza. That's one of the most commonest. Okay. Actually, strep is quite common. Strep is quite one of the commoner. Strep pneumonia. Tapi HIV used to be very common lah, but nowadays memang dah tak wujud dah lah. Rarely lah you dapat HIV. Tapi Haemophilus influenza lah. So kalau patient memang tak vaccinated, kan, then definitely you kena think of ni lah. HIV. Pasal satu social history kan, important you kena tanya macam dia punya crowded, dia duduk kat crowded place ke, satu rumah sampai 10, 20 orang satu rumah kan, atau satu family duduk satu bilik. That can be very important juga. Especially kalau dia orang asing kan, orang asing, orang Rohingya atau for example datang kan, then it could be meningococcal lah. Okay, ataupun ada ill contact. Adik kakak dia ada sawan juga, baru masuk ward sebab sawan, meningitis. Dan takut this is meningococcal, something yang contagious lah. Okay. Consanguineous marriage, good. It's very important consanguineous marriage sebab it could be genetic kan, could be genetic atau semua recessive. Okay, so birthmark also important, you kena tanya. Okay, any birthmark, significant birthmark. Okay, pasal apa lagi? Social history, dark history. Apa lagi history yang you kena tanya? Patient datang dengan seizure. Okay, remember febrile seizure is a seizure with fever that occur in a normal developing child. In a normal children, normal child. You tak boleh kata patient yang ada brain pathology dengan ataupun you memang ada development problem, you kata dia febrile seizure. You can, but it's quite unlikely. Okay. Lepas tu apa lagi? Lagi pasal febrile seizure. What else? Apa lagi? Apa lagi soalan yang kita tanya?
Doktor nak tanya. Yang tadi kan doktor kata kalau seizure kita tengok morfologi dia boleh tahu which location of the brain tu kan. Macam nak tentukan?
It's quite complicated lah actually. It's quite complicated. Okay, seizure kan, contoh kalau orang tu ada focus seizure, okay, contoh dia tangan kanan dia seizure, then lesion dia dekat tangan kanan dia, contoh dia seizure dia pointed to the right, then seizure dia then locus dia biasa dekat kanan. Contoh mata dia lateralization of the eye towards the right, then usually it's the direction of the focus lah. So usually focus dia ialah dekat right side. Biasanya dia ada cara lah, tapi this is neurologist dia tahu lah. Tapi kalau macam doktor macam I ni tak tahu lah, especially neuro memang tak suka. Anyway, okay, faham. Tapi yang tu not that important lah. Tapi you can describe, because you're presenting to your superior kan, you can present in detail. Especially bila dia neurologist, definitely dia nak tahu detail. Lepas tu apa lagi? Okay, itulah kot pasal ni, febrile seizure. Faham, got questions? Medication is also important because nowadays we are seeing a lot of children datang dengan seizure, more and more children datang dengan seizure because intoxication, especially kan, what is common nowadays lah, what is one of the common, taklah common lah, tapi it's happen lah, medication yang boleh buat baby jadi seizure?
Anti-depression or anti-anxiety?
Okay, anti-depression. Dia more to antipsychotic lah
Antipsychotic.
selalunya. Antipsychotic lah biasanya.
Buspiron.
Ha? Apa dia?
Buspiron.
Buspiron apa buspiron? Buspiron ni buat apa? Ya, Lutfil Hadi. Buspiron.
Anti-anxiety. Buspiron.
Boleh ke?
Anti-anxiety.
Mungkin kot. Yelah, tapi anti ni lah psychiatric drug tu satu. Tapi more common than that is actually ni apa tu? Methadone. Okay. Methadone is one of the commoner. In fact, dia siap masuk the exam tu orang. So, dia become so common. Bukanlah so common. It's become quite common now that dia masuk the exam master gitu orang. Okay. Sebab because nowadays a lot of people they on methadone. Okay, because of the kita punya policy kan. Apa tu, opioid replacement therapy. So kita bagi methadone, and nowadays methadone contoh especially yang dos yang behave yang bagus kan. Tu orang drug abuser yang behave yang disiplin, kita bagi dia bawa balik. Okay, they can bawa balik especially bila ada festival lah, ada raya ke. Sometimes KK allow them to bring home. Okay, so problem dengan methadone ni dia warna pink tau, warna pink macam PCM. And biasa dia bagi dalam botol PCM tu, botol macam botol warna putih ubat tu. So kadang parents ni, father lah especially, mother ada juga tapi biasa father lah kot, drug abuse. So father ni dia letak dekat dalam peti ais. So budak-budak ambil minum. Because there are some children yang memang suka PCM ubat kan. Kena ingat dia vitamin ke. So minum and then they've got intoxication. Okay, it's not uncommon lah. I've seen 2 kot so far. So kalau kat KL lagi banyak lah. Okay. Okay, so that's all lah. Rasa that's all untuk febrile seizure. Ada soalan tak? Because febrile seizure is very common and it's definitely akan appear in your exam. So you have to know how to plug febrile seizure. And febrile seizure is very important because lagi satu kan, why is describing seizure is very important? Because there's a lot of movement disorder in pediatric. Okay, the adult the more common in adult is bradykinesia lah. Movement disorder ni you ada hyperkinetic and hypokinetic. Okay, in adult is more common is hypokinetic, especially Parkinson lah kan. Hypokinetic jadi bradykinesia kan. Tapi in pediatric, most of movement disorder in pediatric, movement disorder ni bukan seizure tau. And you cannot treat movement disorder like seizure, tapi these are one of the differential of seizure movement. Contoh patient datang dengan clonus kan. Mak dia kata datang dengan mata kelip-kelip. Mesti kelip-kelip mata ataupun tangan gerak-gerak tangan. Tapi it's actually mungkin dia tics ataupun dia chorea, kita tak tahu kan. Sydenham chorea. So and myoclonus especially in baby lah, baby kecil ni dia ada banyak sangat kita kata non-epileptic seizure. This is like macam kalau later you belajar lah apa tu Sandifer, breath holding spell, these are all like seizure. In fact memang sometimes memang look memang typical like seizure tapi dia not seizure. Okay kan. So ni later lah. So especially in children, there's a lot of movement disorder. For example, like recently kita ada satu patient lah, orang Sudanese. Actually mother datang tengah malam, complain that the child have abnormal movement. Nanti I tunjuk you the video. Okay, I have the video kot. Okay, apa tu? So dia datang dengan abnormal movement. Dia kata tangan dia gerak-gerak for 2 days. Okay. For few minutes. Tapi bila tidur okay. Boleh dia berjaga, boleh dia main dan tangan dia gerak-gerak. So datang ED. Okay, it's our mistake lah. I think one of the pediatric MO suggested, okay, why not you do CT brain? Saya takut seizure kan. So they did, in fact, they did city brain. So parents have to pay like 2,000, you know, 1,000 what? 1,000 for city brain. And then admit what? And then load dengan phenytoin pula. You dah buat city brain normal, load dengan phenytoin. So bagi phenytoin loading 20 mg per kilo. Phenytoin is not a safe drug. Dia banyak side effect. Lepas tu so bila dia masuk ward, and then that morning I came, okay, someone order maintenance lah. Okay, after dah load ni, order maintenance. Oh, I pun pergi tengok patient orang. So, don't baru start maintenance lah, baru pasang drip nak start maintenance phenytoin lah. Saya nampak pasal, don't present lah the case. Saya tanya my MO, dia kata, ni datang dengan seizure, abnormal movement datang dengan seizure. Saya tengok kan, ni bukan seizure. Stop maintenance, stop semua anti-epileptic. This is very typical movement disorder. Mula from video yang dia tunjuk, I thought this is Korea. Saya nampak bahu je. And then bila mak dia describe, and then I look at another video yang lagi long, this is tics. So kenapa you nak treat macam seizure? In fact, tak payah admit pun patient ni. You can investigate tics. Ataupun Korea ni as outpatient pun. As long as dia bukan sidang from Korea yang ada heart failure, typical or rheumatic heart disease kan. Then unnecessary, faham tak? And then lepas tu patient tu dah, because ayah dia student, PhD student, dia need to pay expensive lah sebab ada orang luar kan. Then dia minta request nak go home lah sebab 2,000 dah. One day dah masuk ward 2,000 dia bayar. So memang request to go home. So satu hal pula kita nak kena counsel parents. So kita nak buat EEG, nak order EEG and then nak investigate lah. Dia dah masuk ward, dia investigate. So faham tak? You cost parents unnecessary money. Cost lah to parents. So that's why it's very important untuk you properly clock and you present properly. Okay, faham tak? Okay, so rasa tu cukup. Ada soalan?
Doktor, let's say kalau seizure tu kan banyak causes. So let's say due to intoxication, so kita tak panggil tu febrile fit lah kan?
Tak
Apa
lah,
dia?
tak febrile fit. Intoxication lah.
Oh, macam tu lah. Seizure.
Possible intoxication, seizure secondary to intoxication. Tapi kena tahulah intoxication apa. So you kena dapat history, proper history lah. Kalau tak dapat, then tapi you suspect this is intoxication, you boleh hantar lah urine atau blood to Pusat Acuan Negara. Tapi they still want to ask, they still need information lah. Dia tak boleh dah buat untuk semua benda kan. Tapi dia biasa dia kena ada some clue lah. Macam contoh parents, mother on antipsychotic ataupun ayah memang on methadone. Then dia boleh buat lah some satu. Kau tak kena buat semua ubat. Okay. Ada soalan lagi? Okay, then macam ni nak tahu this is meningitis. Usually meningitis kan, you get meningitis is a translocation of organism, translocation of bacteria or virus, usually from blood to the brain. So before they get to blood, usually dia dapat URTI lah. Biasa upper respiratory tract, go to the blood, and then from blood go to the brain. Okay, ataupun UTI go to blood and then go to the brain. So usually you don't get fever at the onset of seizure. Okay. Kalau contoh patient dah 3 hari demam and then seizure, chances are this is meningitis. Kalau dia baru the seizure and then fever. And remember, for seizure not necessarily fever then seizure. It can be seizure then fever. Fever may come immediately after seizure atau come together with the seizure. Because dia actually the rapid rise of the temperature tu yang cause seizure. Okay, so biasanya lah, most of the time seizure at the onset of fever. Itu biasanya febrile seizure. So kalau dah 3 hari, is meningitis. Okay. Okay, later lah kalau tak ada kelas lagi, kita I'll talk to you about the ABCDE. Kan? The etiology. Okay, tahu kan ABCDE tu kan? Okay, whenever you plug a case, can write down ABCDE. This is to determine the etiologies. A is stand for apa? Salah lah. Vitamin A, B, C, D. I miss the vitamin. So it's vitamin A, B, C, D, E. F pun boleh. Ada yang sampai F, ada yang sampai G. Tapi biasanya vitamin A, B, C, D lah. So vitamin V is vascular, I is apa? Idiopathic, T is trauma ataupun toxin, A is apa? Vitamin A is apa? Autoimmune, vitamin macam tu lah. So you won't miss lah. So bila you tulis vitamin A, B, C, D, then contoh seizure. Okay, what vascular cause of seizure? Ada tak vascular cause of seizure? Ada. Contoh dia ada stroke, kan pediatric stroke, ataupun dia ada cavernous sinus stenosis, thrombosis, ataupun vascular lah, ataupun
Aneurysm boleh ke doktor?
aneurysm dia tak cause stroke. Dia tak cause seizure. Unless kalau ada apa nama of Galen, vein of Galen. Yang tu boleh ada apa vein of Galen macam tu lah. It's like aneurysm lah. Yang tu dia boleh dapat. Tapi it's quite rare. Aku nak jumpa satu je. Units. Tapi itulah. You tulis vascular. Boleh contoh kalau dia ada port wine stain kan. Dia ada port wine stain, rupanya dia ada apa nama sindrom tu. Contoh dia ada memang tanda lahir besar kat muka, port wine stain kan. Then possible dia ada, and then dia ada seizure. It's vascular causes lah. Okay, tu V, vitamin. Lepas tu I, idiopathic. Kita tak tahu. This is febrile seizure lah. Idiopathic is febrile seizure. T is trauma. Dia you kena tanya, ada fall tak? Tak ada. Okay, lepas tu ada toxin. Dia termakan apa-apa lah. Toxin. A, autoimmune. Could it be autoimmune encephalitis? Unlikely lah kalau baby besar ni. Okay, tapi it can be. Post herpes boleh dapat autoimmune encephalitis. Dia banyak lah. Autoimmune encephalitis is more common now. Macam NMDA, encephalitis macam tu. Lepas tu apa lagi? Vitamin E, A, M. M is malignancy. Could be malignancy. Yes, it could. Okay. Benda satu lah. So, you takkan miss lah. So, bacalah about vitamin A, B, C, D. Okay, dia ada je dalam internet lah. Okay, any question? Last question. Ada? Okay, kalau tak ada, you can ask me anytime lah. Just text me pun boleh. Okay, okay lah. Kita stop dulu. Okay, kita tanggungan tasbih kafarah dan surat nas. Okay,
Thank you so much, Doctor.
Okay.
Thank you, Doctor. Thank you, Doctor.
Doctor.
Thank you, Doctor.
Thank you, Doctor.